Hello, this is Dr. Rajesh Yadav from Department of Biochemistry, Calcutta University. Today we will discuss about the breathing mechanism. So we will discuss about the structure of the lungs, bronchioles, classifications, surfactant, type 2 alveolar cells, and breathing mechanism. So I want to remind you here, this is the rib cage where the external intercostal muscles and internal intercostal muscles present, and lower region is showing here as diaphragm. So you can see here this is the diaphragm and this is external intercostal muscles, and this is the rib cage where the lung is situated. Now come to the mechanism of the breathing. The mechanism of breathing has two parts. One is inspiration and second is expiration. So first of all, the contraction of diaphragm and downward movement of the diaphragm. Second step, contraction of external intercostal muscles and moves the rib cage upward direction. In third step, as a result, increase the thoracic cavity volume. And according to the Boyle's law, P1 V1 equal to P2 V2. That means pressure is reciprocal to the volume. So in the inspiration process, when the increase of the volume, then pressure will decrease. So when the pressure will decrease, so the air will come into the lungs, and the process is called air inhalation, because air always moves from high pressure to low pressure. In the expiration process, the relaxation of the diaphragm and external intercostal muscles, while diaphragm move in the upward direction. Second, the contraction of internal intercostal muscles. As the result, thoracic cavity volume decrease. So when the volume of thoracic cavity decrease, so the air will come out of the lungs. So the process is called air exhalation. So this mechanism of breathing, and through the diagram it has been explained. So this is the thoracic cavity and external intercostal muscles, and this is the diaphragm. So when the contraction occurs in the diaphragm, so diaphragm move in the downward direction while rib cage goes into the upward direction. As the result, thoracic cavity volume increase and pressure decrease. So air come inside the lungs. While in the expiration process, the relaxation of the diaphragm muscles. So this is diaphragm is going in the upward direction, or rib cage is coming to the opposite direction. So as the result, the volume will increase and volume will decrease. So pressure will increase inside the lungs. So the air will go outside. That is called exhalation. So now come to the intrapleural pressure. So in the right panel, I have explained about the lungs structure, where it is covered by the two layers, parietal pleura and visceral pleura. Parietal pleura attached to the thoracic cavity in the outer side, while the visceral pleura attached to the lungs. And the pressure of fluid between the lung pleura and chest pleura is 756 mmHg. So this is called intrapleural pressure. So during the inspiration, the value of intrapleural pressure is -5 cm of water, or 754 mmHg. While during forceful inspiration, the value of the intrapleural pressure is 7.5 cm of the water. Now come to the alveolar pressure or intrapulmonary pressure. So it is the pressure of the air inside the lung alveoli. So during the normal inspiration, it decreases to -1 cm of water. This negative pressure is sufficient to pull 500 volume of the air into the lungs. So the alveolar pressure is 759 mmHg. During normal expiration, the value of the alveolar pressure is plus 1 centimeter of the water that force 500 ml air to go outside within the 2 or 3 seconds. So the value of alveolar pressure is 761 mmHg. Now come to the Bohr effect. So carboxyhemoglobin dissociate into hemoglobin and carbon dioxide. So that will happen when the excess of oxygen occur. So in the presence of high oxygen, carboxyhemoglobin break down and it will bind to the oxygen and find oxyhemoglobin. So this effect is called Bohr effect. There is another effect that is called Haldane effect. So that it is opposite to the Bohr effect. When oxyhemoglobin break down into hemoglobin and oxygen in the presence of high concentration of the carbon dioxide. As a result, hemoglobin combine to the carbon dioxide and form carboxyhemoglobin. Now come to the different volumes like tidal volume. Tidal volume, volume of the air inspired or expired in relaxed condition. So the value of tidal volume is 500 ml. Inspiratory reserve volume. The value of inspiratory reserve volume is 3 to 3.5 liter. The volume of the air inspired in forceful inspiration. It is also called complementary air. Expiratory reserve volume. The value of expiratory reserve volume is 1100 ml. The volume of the air expired in forceful expiration is also called supplementary air. Now come to the residual air. So the remaining air, that is 1200 ml air, remain in the lungs after exhalation. It is called residual air. Next is the tidal volume. Tidal volume, volume of the air inspired or expired, we have already discussed here. Now the topic alveolar ventilation. Amount of the air reaching alveoli in each minute is called alveolar ventilation. It can be defined as the multiplication of the respiratory rate into tidal volume minus anatomical dead space. Pulmonary ventilation. Pulmonary ventilation is a multiplication of the respiratory rate into tidal volume. Thank you.